Hi Mercer, my name is Krisha Patel and I'm from Johns Creek High School. Let me give you a little glimpse of who I am. From a young age, I was taught the meaning of seva, which means selfless service in Hinduism, a concept that I learned using my hands. I first learned this way of life through my spiritual classes and summer camp. With my hands, I served food, helped organize donation drives, and cared for our environment by picking up trash. Seva wasn't taught as an occasional act, but as a daily practice. In free medical clinics, my hands have checked vital signs and recorded vision exam results. A veces, hablaba en español para que los pacientes se sintieran más cómodos. I also learned that many patients could see a physician, yet could not afford their medications. That realization pushed me to use my hands differently, to create a website compiling free clinics, links to low-cost medications, and affordable imaging. Research taught my hands a different kind of service. At Emory University, I worked on a vein graft failure project, investigating how materials like surgical glue or sutures might trigger inflammation and neoantigen formation. Through GTF, I have also presented research at national and international medical conferences. Research showed me that service can be meticulous and unseen. However, collaboration of data is essential for medical advancements. Leadership and advocacy have also shaped how I use my hands. Founding the SAD chapter at my school allowed me to deliver addiction, health education, and safety initiatives. Through Raksha Youth Advocacy, my hands helped organize solidarity walks and conversations about healthy relationships and mental well-being. Change, I learned, is built collectively. I find balance through outdoor adventure, tennis, and dance. With my hands steady on a racket and moving in rhythm through Bollywood choreography, whether motivating my teammates or teaching my non-Indian friends to dance, these moments remind me that service creates joy and connection. Mercer will place my hands at the forefront of seva from the very start of my journey. Through the Mercer on Mission Prosthetics program, my hands would learn how to fit prosthetics for people in need in Vietnam, which would be the experience of a lifetime for me. Mercer would allow my hands to give back at a local food bank, clean up a neighborhood, or help with a housing project. Mercer's Health Volunteer Service Program will also allow my hands to start working in Georgia's rural communities with uninsured patients and those struggling with substance use disorders, issues I care deeply about. I hope to work with the Center for Rural Health and Health Disparities to create health initiatives that expand access to care and to build on the website I created that lists affordable medications and imaging services. I plan to grow this platform at Mercer and reach even more underserved communities. Leadership and research will also shape how I use my hands at Mercer. Drawing on my experience as SAD president, I want to contribute to Mercer's research on the neurobiology of drug abuse and help design community-based prevention and education programs that turn what I learn into real impact. I hope my next chapter of seva can begin at Mercer, where I can unite service, research, and advocacy to contribute to the Mercer community.